This is KNX In Depth. Mike Simpson and Charles Feldman.
A new federal report finds that every year, tens of thousands of people enrolled in private Medicare Advantage plans are denied necessary care that should be covered. These plans have been growing in popularity over the years as they're often less expensive and provide a wide number of benefits compared to the traditional government-run program offers.
The investigators urging Medicare officials to strengthen oversight of these plans. With us now is Paul Seegert, managing partner at PCS Advisors, health benefits consulting firm. Paul, thanks for being here. So just so we're all on the same page, these plans, a little different than regular Medicare, but still should have been giving these people the things that they needed.
That's right. They are private plans that are supposed to deliver the same benefits to their members as government-provided Medicare. And then their goal, of course, is to run it at a profit. And I think what we're seeing here is an example of how that can get off track.
Well, the idea, right, as I understand the Medicare Advantage plans, is if you are on Medicare but you want certain other things that Medicare does not provide, like eye care, right, or dental care, then some people go to these Advantage plans. Are they just not delivering the services that they claim they're delivering, or do they find sort of sneaky ways to deny payment, which regrettably all insurance companies seem to do?
Yeah, I think it's the latter. They have been found to deny almost 1 in 5 treatments that should be approved. And they may have rules in place within their Medicare Advantage protocol that don't match up with Medicare's rules of what might need to be met in terms of requirements prior to getting a service. Maybe you need to have an X-ray before you get an MRI, which might be unique to that Medicare Advantage program, but is not a requirement of Medicare. And so it is resulting in people not getting care that they essentially are paying for or have paid for throughout their lifetime to get in at this time in their life.
Now, are they allowed to have those kind of extra steps you're supposed to go through? I mean, past a certain point, if regular Medicare was going to give this to me anyways, why do I need to go and get these tests and that test before getting the procedure that I need at the end of the road?
Yeah, they really aren't supposed to have these other steps. Their kind of response or pushback to this study is that they are the result of human error. What's interesting to me is that the human error is kind of consistently leaning one direction. So that makes you certainly question that, and it's a good thing that it's being looked at.
Funny how that works. Yeah.
Yes, it's a little-known ailment, perennial human error. Is there some reliable place or way that somebody who is in the market for a Medicare Advantage plan can find out if they're choosing the lesser of the evils?
That's where the trouble is. I think not only with Medicare, but with our payment model in general, is that at time of enrollment, it's natural that a consumer is going to pick a low-cost option. It's not low cost without, just very generally speaking, if it's lower cost and they're giving me more services, they're going to have to do something to make that work financially. Because when you step back and look at the big picture of our healthcare system, Medicare already tends to underpay providers and hospitals, sometimes at a loss. So if you're going to go into these Medicare Advantage plans, they're going to give you even more benefit. There's going to be some give and take there, and really take. In some cases, you're going to give up access. Maybe you don't have access to all of the physicians like you might. They might limit it that way, or they might make their program profitable by limiting access to care, like we're seeing here.
Yeah, and do they just try and low-cost the people, too? Like, if it's deemed you need to go to, like, the rehab center for something, they say, you know what, denied, go do it at home because that's cheaper.
Yeah, I mean, there is some of that goes on. You have people that maybe should have been released into skilled nursing and weren't. There's some of these things are pretty egregious and just driven by the financial benefit to that Medicare Advantage program.
So other than having Elon Musk pick up your medical costs, is there a solution?
If you tweeted him, he might.
Maybe
he
he will.
does stuff all the time.
I mean, is there...
He replies to people.
Is there a solution?
Well, I think the solution is fixing the whole payment model, which is obviously a massive proposition here. But when we get down inside what these plans are paying, when someone goes out in this example and gets a prescription, we shouldn't be paying 4 times what our peer countries are paying for that drug. And drugs are driving a huge part of this whole conversation. And we shouldn't have our consumers paying 4x for the same exact drug that was likely developed by a U.S. company. Our peer countries shouldn't get that at 1/4. If we can address some of these systemic causes of waste in our system, then we won't have to see things like this occurring for these programs to be profitable.
So people have talked about that for years, though. Are you more hopeful now than you have been in the past that that's going to happen?
I am more hopeful. Yeah, I really actually am. I'm not hopeful that lobbying is still effective, so that'll slow change. But I'm optimistic, and I see examples all over the country, and it's a growing trend where employers who are running a health plan are hiring consultants, getting into the details, finding out where the waste is, cleaning it up. And that trend is going to spill over into other areas of healthcare, the healthcare payment models, the other, whether it's government provided care, individual plans, et cetera. As they put a spotlight on this waste and fix it, I think that's going to drive the solution for the whole country. And I am actually optimistic about it. It can be a depressing conversation at times, but we're seeing some very good signs, at least in the employer payment model.
I think I'm just going to submit my next medical claim to Elon Musk and hope for the best.
But for people who are literally like trying to pick one and they're sitting there scrolling and they're like, "Oh, I'm going to do an Advantage plan." How do they know? How do you pick at least as close to what you're going to want as possible?
Well, I think you may step back and say, should I do an Advantage plan for this monthly reduction in cost, or should I go with traditional Medicare? And it may make more sense just to understand the risks, with a reduction in cost, or if you're getting additional benefits for the same price, you are going to have to give up something along the way for that. They may limit access. They may limit the number of facilities you can access. They may deny care or make it tougher and jump through hoops and so on. So it might be worth paying a little bit more monthly to have a higher level of confidence.
I mean, in most cases, would it be better for people to just stick with conventional Medicare?
Well, when my parents asked me, that was my recommendation.
Really? So you said don't bother with any of the Advantage plans, just stick with Medicare.
That's right.
It's Paul Seegert, managing partner, PCS Advisors, health benefits consulting firm. Paul, thanks.